Welcome to the deep dive. Today we're tackling a really big topic, artificial intelligence in hospital quality improvement. QI, right?
That's it. AI and QI.
We've pulled together some, fascinating sources to really explore how AI is starting to move past just the buzzwords.
Yeah, getting into how it actually makes hospitals, faster, maybe smarter, and hopefully more effective.
So we're looking at things like data analysis, predictive modeling, automation, that sort of thing.
Exactly. And our mission for this deep dive, if you like, is to understand the real, tangible ways AI is actually boosting hospital quality and patient safety.
Cutting through the hype.
Trying to, yes. Looking at practical uses, the key things hospitals need to think about.
Okay, so let's start there. When we talk about AI and hospital QI, what exactly are we? What technologies are we really focusing on?
Good question. So at its core, you're looking at things like machine learning, natural language processing, NLP, and predictive analytics, all applied to healthcare improvement.
Machine learning. That's the part where the system learns from data, right? Without explicit programming for every single step.
Precisely. It learns patterns from all the data hospitals generate. And NLP, that's about understanding language. Think doctor's notes, patient feedback, AI reading, and understanding that.
Okay. And predictive analytics. That sounds like crystal ball territory.
Well, sort of. It uses historical data to forecast what might happen.
Yeah.
Potential risks, likely outcomes. It gives hospitals a way to be more proactive.
Right. Proactive instead of just reactive. So how do these AI tools actually translate into, say, better quality improvement?
Fundamentally, there are, I'd say, three main ways. First, analyzing huge data sets. Clinical records, outcomes, operational stuff. AI can spot patterns humans would likely just miss.
Too much data for us to process easily.
Way too much. Second, predicting patient outcomes, like we just mentioned. This helps prevent adverse events, tailor care plans better. It's about getting ahead of potential problems. And third, automation. Taking over repetitive QI tasks, tracking metrics, reporting that frees up healthcare professionals.
More time for patients, hopefully.
That's the goal. Less time on admin, more on care.
That makes a lot of sense. I'm really interested in how this impacts patients directly, at the bedside. Can you give some examples there?
Absolutely. Diagnosis and treatment is a big one. Imagine AI looking at medical images, CT scans, X-rays.
Yeah.
It could often analyze them incredibly fast and sometimes with really high accuracy, potentially faster, more precise diagnoses.
Wow. And helping doctors decide on treatments.
Yes, AI-powered clinical decision support. Think of it as a sort of super assistant for doctors, giving real-time, evidence-based suggestions while they're planning treatments.
Like an instant second opinion, almost, based on vast amounts of data.
Kind of, yeah. Helping them make informed choices quickly. Then there's personalized medicine.
Tailoring treatment to the individual.
Exactly. AI can analyze a patient's specific data, genetics, history, lifestyle, to build really individualized treatment plans.
The aim being better results and fewer side effects.
That's the idea, fine-tuning the therapy for that specific person.
And what about monitoring patients, especially those who are quite ill?
Another key area, continuous monitoring. AI systems can watch vital signs from sensors, wearables in real time.
Constantly analyzing the data stream.
And if it detects a worrying pattern or a change from the patient's baseline, bang! It alerts the staff immediately, much faster than, say, intermittent checks.
That could be life-saving.
But potentially, yes. That always-on AI vigilance is a big plus.
Okay, let's shift gears a bit. Hospitals are complex beasts operationally. How's AI helping behind the scenes?
Big impact there, too. Administrative tasks, for one. Scheduling, billing, data processing. A lot of that can be automated.
Taking the load off staff.
Exactly. Freeing them up to focus on patient care, which is where they're needed most. Resource allocation is another one.
Managing beds, staff, that kind of thing.
Yeah. AI can help predict patient flow, figure out staffing needs for different units, optimize bed use, making things run more efficiently.
Using resources smarter.
Right. And also risk management. AI can help identify potential safety hazards proactively before something happens.
Finding risks we might not see otherwise.
Potentially, yes. And of course, the data analysis piece is huge for operations too, spotting trends to guide QI efforts across the whole hospital.
So it's really feeding back into that improvement cycle. How does this help with the specific quality indicators hospitals are always tracking?
Well, predictive analytics is key again. Forecasting potential problems allows for interventions that directly boost those metrics.
Like predicting infections or falls.
Exactly. Or take something like Epic's deterioration index. It uses AI to predict who might need an ICU transfer, sometimes hours earlier than we'd normally spot it.
Giving clinicians a heads up.
A crucial heads up. AI also helps track and analyze all those key performance indicators, KPIs, staff levels, bed usage, patient satisfaction.
Pinpointing where improvements are needed.
Based on real data patterns. And even things like predicting when equipment needs maintenance. That reduces downtime for vital machines.
Keeping everything running smoothly. It really touches so many areas. Are there other, maybe less obvious applications?
Oh, sure. Robotics is one. AI-powered robots doing things like transporting supplies, maybe even cleaning.
Taking on some of the logistical work.
Yeah. And AI in communication tools is fascinating too, helping patients, families, and care teams connect better.
How does that work?
Think AI chatbots answering common questions 24/7, setting appointment reminders, delivering personalized instructions after surgery. It improves engagement, helps people stick to their treatment plans.
Constant support, almost.
A form of it, yes.
Yeah.
Making information more accessible.
This is great. We also looked at the QI Playbook podcast, which actually did an episode on AI and QI. What were their main points? Did they echo what we're saying?
You really did. It was quite validating, actually. They defined AI and QI very similarly. Machine learning, NLP, predictive analytics.
Okay.
And they hit on many of the same key applications. Predictive analytics for patient safety, predicting infections, falls, early warnings for sepsis. That was big for them.
Right, those critical safety nets.
Exactly. Also, process optimization, analyzing patient flow, suggesting staffing changes, and clinical decision support treatment ideas, flagging drug interactions.
Pretty much covering the same ground.
Yes, and automating routine audits and reporting too. Checking records for issues automatically. Faster, maybe more consistent.
And patient engagement.
That too. Mention AI chatbots for answering patient questions, providing support.
It's good to see that consistency. Now, implementing this stuff isn't always easy. Did the podcast talk about the challenges hospitals face?
Oh, definitely. They highlighted several big ones. Data quality is huge. AI is only as good as the data it learns from.
Right. Garbage in, garbage out.
Pretty much. Then there's integrating AI with existing systems, especially electronic health records, EHRs. That can be technically complex, compatibility issues.
Getting everything to talk to each other.
Yeah. And change management, getting staff trained, getting them to trust and actually use the AI tools effectively. That's a human challenge.
Culture shift, almost.
It can be. And finally, resources. The cost of AI systems and the expertise needed. That can be a real barrier, especially for smaller hospitals.
Very real-world constraints. Did they give any examples of hospitals actually overcoming these hurdles? A case study, maybe?
They did, yeah. A really good one. They called it Med Health System, a large network. They wanted to tackle high ICU readmission rates.
A common and costly problem?
Their goal was specific: cut 30-day ICU readmissions by 15%.
Okay, so how did they use AI for that?
Their QI team used AI to analyze tons of patient data, vitals, history, meds, even discharge notes, looking for subtle patterns linked to readmission risk.
Patterns humans might not easily spot.
Exactly. They trained a machine learning model to predict which patients were most likely to bounce back to the ICU soon after leaving.
So they had this predictive tool. What then?
They built it right into their EHR system. So when a patient was getting ready for discharge from the ICU, the system would flag the high-risk ones in real time for the clinicians.
An immediate alert.
Right, so the care teams knew who needed extra attention. They could then put in place targeted follow-up, maybe more monitoring at home, specific interventions before the patient even left.
Being proactive based on that AI insight. And the results, did they hit their target?
They actually beat it. Within 6 months, they saw an 18% reduction in ICU readmissions.
Wow, 18%. That's significant.
It really is. It showed how AI could lead to measurable improvements in outcomes and likely saved resources, too. Patients got more personalized, proactive care. A great example of AI in action for QI.
That really illustrates the potential. Now, thinking bigger picture, how does all this AI adoption connect with hospital accreditation? Bodies like JCI, for example.
That's a really interesting angle. AI can actually help streamline the whole accreditation process. Think about compliance reporting for bodies like JCI or NABH in India.
JCI is the big international one, right? Setting global standards.
Exactly. Joint Commission International. They're a global leader focused on healthcare quality and patient safety standards. AI can help hospitals gather and analyze the data needed to show they meet those standards. Makes reporting potentially easier, more accurate.
So AI helps demonstrate quality. What's JCI's overall vision in this tech era?
Well, their big vision is aiming for zero harm and highly reliable healthcare delivery. They work with hospitals worldwide, pushing for continuous improvement, best practices. Their mission is basically enabling and confirming the highest standards of care and safety for everyone.
And you mentioned NABH in India?
Yes, the National Accreditation Board for Hospitals and Healthcare Providers. They set the accreditation standards specifically within India, part of the Quality Council of India. They play a similar role, setting benchmarks for quality.
So the improvements AI drives better safety, better outcomes, more efficiency. They directly support the goals of these accreditation bodies.
Precisely. When hospitals use AI effectively for QI, they're inherently working towards meeting or even exceeding the standards set by JCI or NABH. It all ties together. Better AI use can lead to better accreditation standing, which reflects better care.
Okay, so to make this even more concrete, are there well-known hospitals out there already using AI for QI in noticeable ways?
Oh, absolutely. Several leading places. Mayo Clinic, for instance, uses AI for things like earlier diagnosis and optimizing treatments.
Right.
Mount Sinai in New York has used deep learning to predict acute care events, trying to intervene earlier.
Proactive again?
Yes. And Apollo Hospitals in India uses AI tools for early detection of cardiac problems. These are just a few examples, but they show it's happening now in major centers.
This has been, well, a really insightful deep dive. If we were to sum up, what are the key takeaways on how AI is changing hospital QI?
I'd say it's enabling much more data-driven decisions, uncovering insights we couldn't see before. It's clearly helping enhance patient outcomes through better diagnosis, personalized treatments, closer monitoring.
Reducing errors, too.
Yes, potentially reducing errors, streamlining workflows, making hospitals more efficient, and really supporting that shift towards predictive and preventive care, rather than just reacting to problems.
It's amazing to think about those aha moments AI might provide, finding patterns in all that data noise.
Exactly, those hidden correlations. And look, we know there are challenges. Data quality, integration, getting people on board, it's not simple.
Right, the implementation hurdles are real.
They are, but the potential benefits for quality and safety are just huge.
So as AI gets woven more deeply into healthcare, here's something for you, our listener, to think about. How is this going to change what we even mean by high-quality care? And what new questions does this raise about balancing this amazing technology with the essential human touch in medicine?
Good questions to ponder.
Definitely. We encourage you to keep exploring these AI applications and the work of organizations like JCI and NABH. Thanks for joining us on this deep dive.